Hi everyone, I'm Dr. Shahida Umer, Consultant Family Medicine at GMC Clinics. I'm here today to give you some short but very important information about the novel coronavirus or the COVID-19. Coronaviruses are a group of viruses which causes respiratory infections in humans, which are often mild. But in the last 20 years, 3 strains have been found which can cause more serious infections like pneumonia. They include the SARS virus in 2003 with a mortality rate of 10%, the Middle East respiratory virus in 2012 with a mortality rate of 34%, and the current strain called the COVID-19 with a mortality rate of 3.5%. The virus was initially isolated in a cluster of pneumonia cases in Wuhan city, the Hubei province of China. The COVID infection is currently declared as a pandemic by the World Health Organization. The virus is spread from person to person through the contaminated droplets released by the sick person while coughing and sneezing. It is also spread through contaminated hands and by touching contaminated surfaces. The incubation period, or the amount of time from being exposed to the virus to showing the symptoms, can range from 2 to 14 days. The symptoms can vary from very mild symptoms like runny nose, fever, cough, headache, to more severe symptoms like shortness of breath and chest pain. Currently, there are no vaccinations available for COVID-19 infection. The treatment includes isolation and treating the symptoms and easing the complications. The virus transmission can be prevented by thorough washing of your hands for at least 20 seconds using soap and water. If this is not available, you can use an alcohol gel to clean your hands. If you're having any respiratory illness, stay at home until you're fully recovered. Avoid going to crowded places or gatherings and eat well-cooked animal products. If you are coughing or sneezing, use a tissue and discard the tissue properly. If tissues are not available, cough into the inner part of your elbows. The World Health Organization is not suggesting a regular use of masks by the general public, as it can cause the user to touch the face regularly, which can increase the risk of transmission. The only 2 occasions where the use of masks are advised is if you are having any respiratory illness or if you are caring for somebody with a respiratory illness. Avoid all non-essential travel abroad, and if you are traveling into UAE from a country where there is a widespread outbreak of COVID-19, you may be asked by the airport authorities to stay at home for 14 days. Not everyone with an upper respiratory symptom needs the COVID-19 testing. People with symptoms and with a travel history to any of the countries with a widespread outbreak, and also people with symptoms who have been in contact with a confirmed case of COVID-19 or a strongly suspected case of COVID-19 needs testing. If you're having any mild symptoms as described before, please call your doctor or the DHA helpline for further advice. You will be asked to take all necessary precautions and attend your nearby primary healthcare service where testing facilities are available. If you are experiencing any severe symptoms like shortness of breath or chest pain, call the ambulance services or the nearby hospital who can prioritize the services to be provided. It is very important that you look for reliable information on websites like Dubai Health Authority, World Health Organization, and CDC, rather than relying on social media speculations. I hope this information was useful to you, and I wish you all a great day ahead. Thank you.